You may have seen this graph making its way around the news, or this hashtag on social media, #FlattenTheCurve. And what it shows us should concern every American. The coronavirus disease has now spread to 49 of the 50 states, with the United States reporting 4,392 confirmed cases and 75 deaths, according to Johns Hopkins University of Medicine. The United States healthcare system has capacity, and we need to be prepared.
And this afternoon, we're announcing new guidelines.
Tonight, America's hospitals and healthcare workers under siege.
The CDC director to use his authority under law.
Essentially, the preventative measures laid out by the state and federal governments are what's keeping this curve below the line of capacity. But it's up to us to adhere to social distancing, restrict our movement outside the house in densely populated areas, and reduce our interactions in group settings below groups of 10. But according to trends from other countries, the worst is yet to come. And that will put a strain on the healthcare system. As New York Governor Andrew Cuomo said, we have a privatized healthcare system where we don't have extra ICU beds lying around.
The system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds.
Initially, testing was incredibly limited. One of the reasons South Korea has had relative success tackling the disease is because it's able to identify cases quickly due to availability of tests. Representative Katie Porter from California made this very point to the CDC director.
Dr. Redfield, you don't need to do any work to operationalize. You need to make a commitment to the American people so they come in to get tested. You can operationalize the payment structure tomorrow.
I think you're an excellent questioner, so my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance.
So let's look at testing. Testing is done by a swab deep into the nasal cavity to collect cells from the back of the nose. This is the same process to test for the flu. That sample is sent to a lab, and labs are expected to produce results 24 to 72 hours after the test, digitally. The CDC is currently recommending those who show developing symptoms to get tested. The Secretary of Health and Human Services, Alex Azar, announced that 2.1 million testing kits are now available, with 1 million being distributed. Tests are now being done in pop-up locations across the country to reduce the strain and risk of bringing possible patients into hospitals. But hospitals are dealing with their own potential problems. Respirators, for example, need to be replaced after a doctor, nurse, or other healthcare provider interacts with a patient. But it looks like we're going to run out of those, as the US Strategic National Stockpile hasn't been replaced since 2009 from the H1N1 virus. There's also a major concern that ventilators will be unavailable as the strain is pushed onto hospitals. Ventilators are critical in making sure coronavirus patients who develop viral pneumonia are able to breathe. The healthcare community is trying to move people who are not in any critical condition off of hospital beds to make space for what's to come. Because, as Dr. Anthony Fauci put it, we have to overreact just to react.
And the thing that I want to re-emphasize, and I'll say it over and over again, when you're dealing with an emerging infectious diseases outbreak, you are always behind where you think you are if you think that today reflects where you really are. That's not word speak. It means if you think you're here, you're really here because you're only getting the results. Therefore, it will always seem that the best way to address it would to be doing something that looks like it might be an overreaction. It isn't an overreaction. It's a reaction that we feel is commensurate.
Facts first.